The Office of Child Development and Early Learning is committed to taking steps to ensure the best developmental outcomes for children and families in Pennsylvania by providing families and early childhood professionals with resources and supports that promote optimal developmental outcomes for young children. The Center for Disease Control and Prevention and the American Academy of Pediatrics updated their Developmental Milestones checklist for infants and young children for the first time in over 10 years. When thinking about the importance of optimal developmental outcomes for children, we know family-engaged developmental surveillance and monitoring is an effective method that leads to the early identification of developmental delays in young children. That is why the Center for Disease Control's Learn the Signs Act Early Milestones checklist and other materials are a recognized resource in Pennsylvania for use by families and early childhood professionals. The Learn the Signs Act Early tools and resources are communication tools that aim to promote developmental monitoring by tracking developmental milestones and to encourage conversations between families, healthcare professionals, and early childhood professionals about child development. They are not developmental screening tools, nor are they standards or guidelines. The Learn the Signs Act Early materials offer a way to engage families, guardians, and other care providers in ongoing developmental surveillance and monitoring, and empower them to act early if they have concerns by discussing them with their child's healthcare professional, asking about developmental screening, and contacting early intervention if they still have concerns. Developmental surveillance and screenings are two processes that assist families and early childhood professionals in the early identification of developmental delays in young children. Developmental surveillance and screening are two different but complementary processes. Surveillance is ongoing developmental monitoring, and screening involves the use of a validated screening tool done at specific intervals. Both are recommended by the American Academy of Pediatrics for early detection of developmental delays. Together, surveillance and screening improve early identification. The milestones checklist used as a component in developmental surveillance are not a substitute for a standardized, validated developmental screening tool. Since 2004, the Developmental Milestone Checklist have been used by early childhood professionals and families. Revisions were completed in 2019, and the process and results were published in February 2022. After 18 years of use and feedback from professionals and families, the CDC has aimed to 1. Be able to offer a free milestone checklist for every age at which there is an American Academy of Pediatrics recommended well child health supervision visit between 2 months and 5 years, which meant that they added the 15th and 30-month checklist. Second, assigning milestones to ages when most children, 75% or more, would have reached them, and thereby reducing the wait and see approach to acting on missed milestones. And finally, they wanted to address families and early childhood professionals' feedback that having very similar milestones across checklists was very confusing. To address these concerns, a team of developmental experts developed 11 criteria for the revised milestones checklist, and as a result of the process, the milestones have been reduced from 216 to 159 milestones. 25 duplicates were removed. The average number of milestones were reduced from 23 to 13. 95 milestones were retained and 65 are new. 1/3 of retained milestones were moved to a different age, and 2/3 of retained milestones were moved to an older age. So what do these changes mean for families and those who support them? In the previous checklist, the milestones were included that indicated only half of children, 50% or more, will be expected to meet the milestones by the specified age. As a result, it wasn't clear whether any action should be taken if a child was not meeting the milestones. So by revising the milestones, the aim is to make it more clear to families and other care providers that missing a milestone was something which needed action. The updated milestones were chosen to reflect what most children, 75% or more, would be expected to be able to do by specified ages to better identify potential concerns. Also, the language in the checklist have been changed as well. The milestones now include clear-cut behaviors that mean a child is on track, or they may be falling behind. The tips and activities for supporting children's development were expanded. Additional open-ended questions were added to help facilitate conversations between families, healthcare providers, and others. The when to act early milestones warning signs or red flags were removed. And the American Academy of Pediatrics added more social and emotional milestones in contrast to language, cognitive, and physical milestones. In addition to the core changes to the milestones, important information to also know about the revisions includes: the changes to the milestones were not related to or influenced by the COVID-19 pandemic. The review of evidence and revisions were completed in 2019, and family testing for understanding and relatability was done in the summer of 2020. It is not expected that the new milestones will result in any unnecessary referrals to early intervention programs or for further evaluation. The old Learn the Signs Act early milestones and checklists can still be used while programs and early childhood providers transition to using the new materials with families. However, the new milestones represent those that most children, 75% or more, will be expected to achieve. So Learn the Signs Act Early encourages programs using the old materials to transition to the new materials when feasible. We know that families in Pennsylvania represent diverse cultures and languages, but the milestones and open-ended questions were tested with a demographically diverse group of English and Spanish-speaking parents of young children 2 months to 5 years of age to ensure comprehension of the milestones and ease of use in determining if their child had reached the milestones. Findings were used to further refine the milestones descriptions. More than half of the literature used to inform the revisions to the milestones was based on international studies from non-English speaking countries. 2 native Spanish-speaking pediatricians reviewed the Spanish translation of the milestones, and CDC's multilingual services certified the translation process. Efforts were made to select milestones that families and caregivers could observe in a child's natural setting, including the home, preschool, or in the community. And they were written using family-friendly language at a 5th through 7th grade reading level. Materials on the Learn the Signs Act Early website can be viewed in English and Spanish. Many materials are also offered in simplified Chinese, Korean, and Vietnamese, and they can also be translated into other languages, including Russian, Turkish, French, Indonesian, Bengali, Urdu, and Portuguese. The CDC continues to review data, gather information, and collect feedback from providers and families regarding the revised milestones. For more information, access resources, and order materials about Learn the Signs Act Early on the CDC's Learn the Signs Act Early website, please visit www.cdc.gov. Those who have additional questions, would like to learn how Learn the Signs Act Early materials can be used in their local program, or would like a more detailed presentation about Learn the Signs Act Early's materials, resources, or revisions, can contact myself, Ilecia Voughs, at ivoughs@PaTTAN.net. And finally, families who have questions about their child's development may call the Connect helpline at 1-800-692-7288 or email help@connectpa.net. The Connect helpline assists families in locating resources and providing information regarding child development for children ages birth to age 5. In addition, Connect can assist families by making a direct link to their county early intervention program or local preschool early intervention program.